Welcome back to Open for Business. It's Chuck Freeby, joined by Kent Laudeman, who is the director of the Suicide Prevention Center for St. Joseph County. And Kent, we've seen ads run during sporting events from the Indianapolis Colts talking about taking away the stigma of mental health and talking about that and depression. What kind of things are you and your area working on about taking away the stigma of talking about mental health and suicide?
Well, it's certainly something we need to talk about. There's no question about that. So I do a yellow ribbon program in school for junior high school, senior high school students, mostly in health classes. And it's a 1-hour presentation. And basically we kind of focus on, you know, I can save a life, you can save a life, we can save a life if we know what to do. So talking about it is getting rid of stigma, okay? And my background as such is that I'm a survivor, 3 suicide losses and battle buddies as far as armed forces are concerned. I also do a suicide survivor support group, so I can identify with that group. I do a pretty good job with kids because I can bring my Army background in as far as some stories are concerned. So it's something we just need to talk about, okay? Get out there.
You mentioned the suicides that you have been unfortunate to see from people that you know. What were some of the risk factors and warning signs that we should know about? What are some of the things that we can do to be active in suicide prevention?
Well, we know that risk factors are there for young people. You know, suicide numbers were going down in 2019, 2020, and all of a sudden, CDC report now in 2021 and 22, they're inching back up 3% in that area. In fact, 2021 was up for young people by 8%. And of course, COVID had some impact on that. So one of the risk factors, I think, is not being connected. I mean, you have to have friends, family, friends you can talk to, you can get help from, etc. But basically, probably a primary risk factor if somebody is looking for a way to die by suicide or kill themselves, either online or asking questions. I mean, that's pretty much a red flag.
So now once we get to intervention then for that, what are some of the steps that can be taken both on a local and national basis for suicide intervention?
So intervention, we've got local resources, which would be Oak Lawn's walk-in services, and there's 2 evenings that are open. There's the emergency room. We know the crisis center is now coming next to Epworth there, and that's going to be 14 reclining chairs where we can bring somebody in. Police officer could drop somebody off, family member could bring somebody in, and do an assessment and say, hey, how serious is this particular thought as far as ideation is concerned? Do you have a plan? Have you attempted? And one of those risk factors is if you've attempted in the past, that's another strong red flag that we need to be listening to, okay? Now, there's also, nationally speaking, 988. It used to be 1-800. I never remembered the 7 number. I just remembered to spell suicide, okay? But now it's 980. You can chat, you can text, and you can talk. Any one of those 3. And there's 741-741 for texting, a direct line for texting. So, and that's 24/7, 365. I mean, for me as an Army person, Armed Forces, that's a battle buddy.
Sure.
That if I'm talking to somebody and I suspect they're thinking about suicide, and I'll say to them, hey, do you mind if I call the crisis line and bring a third party into this? And I've done that several times. When I'm unsure about where that person is at in terms of thinking, maybe planning, and do they have the means? So that resource person, a battle buddy for me, battle buddy for you, anybody is there for help and assistance 24/7, 365.
After the battle, when you had gone through that as a survivor, having seen people go through that, what kind of mental health things were available for you as a survivor?
Well, I really didn't because of the stigma on the first one. First battle buddy to suicide was Vietnam, so that's a long time ago. I mean, we weren't talking about it a whole lot. The most recent one was Jason Rhodes, the commander of the Marine Corps League here in town. And one day he was supposed to be back. The Marine Corps League didn't come back, went looking for him, and found out he had died by suicide. So one, we need to, for survivors, know that there are services out there. And almost every county, Plymouth, LaPorte, Goshen, has a suicide survivor support group. And I do a suicide survivor support group. that grief for that survivor is very unique. It's unlike somebody that dies from, let's say, heart disease, cancer, anything like that, okay? Because we know the why. But somebody that dies by suicide, no, the survivor just has a hard time and they want to know the why. And they want to know, gee, did I miss some risk factors there? So there's some guilt that they're dealing with.
Right.
I mean, it's a unique kind of grief that they struggle with.
So what other resources are out there besides your center?
So beside those suicide survivors support groups, you can go online with the American Foundation for Suicide Prevention, AFSP. AAS, American Association for Suicidology, is out there, okay? And they have virtual support kind of groups and services that are available to survivors. And tape conversation where past survivors have talked about their life, how they got it together after that. And grief stays on. I got somebody in my group that lost her mother almost 30 years ago. So it's a unique kind of grief that we're dealing with.
Well, Kent's programs are offered as part of United Health Services. And if you wish to learn more about these suicide prevention programs, we encourage you to go online to uhs-in.org/programs/suicide prevention.